Hello and welcome back to Dr. Carri's Clinical Corner. Today we're going to talk about fitness and health in menopause. So recently, at the time of this recording, I attended a lecture given by 4 PTs in Sonoma County, all about the up-to-date recommendations on fitness, health, nutrition, things like that for menopause. So thank you to the California Physical Therapy Association for that and for those ladies. I'm going to summarize this for you, and I'm going to look at my notes a few times to make sure I get you all the good information. So it was really, really good information. Some new things that I learned from this lecture and some old things. So first, let's talk about cardiovascular fitness. So often in women after menopause, they have trouble with weight gain. And so the up-to-date recommendations for cardiovascular fitness is to focus more on HIIT, high intensity interval training, or sprint training versus long, slow duration cardio. So I didn't take a lot of notes in this lecture, but I remember these things, and I'll try to link some stuff later if I can. But the premise is sort of like a couple things, like that was better for metabolism for women after menopause, and also it takes longer to recover, and so that was better for recovery. And yeah, just sort of that long, slow endurance wasn't enough to make a difference either cardiovascularly, metabolically, weight loss wise, all those things. So focus on sprint training, and they had some specifics, so this is fascinating to me. So sprint training is not running sprints. It can be on the bike, it could be swimming laps, it could be running, it could be, you could use some sort of weight training or any sort of modality, bike, assault bike, rowing machine, anything. And so basically the recommendations are to do an interval between 8 and 30 seconds. It should be 85% of your heart rate max. So that's kind of very specific, but on a scale of 0 to 10, it should be like a 9 or 10. Like it should be hard. Okay, and then you're going to take a 12 to 20 second rest, and you're going to repeat that 6 to 8 times. That's one set, and then the recommendation is to do 3 sets of that. Like that's your cardiovascular training, and the recommendation is twice a week for that. Okay, so that's what you should be doing twice a week for cardio. So on the other days you could do something else, but this is what makes meaningful change. So very interesting stuff. You know, I think a lot of people, they're walking, they're on the bike, they're on the elliptical and just trying to do 20, 30 minutes, whatever. But this is a very different style of training. So if you like CrossFit, do CrossFit. If you have a trainer, work out with a trainer. If you go to a group fitness class, do that. If you want to do it on your own, just think about like sprints, 8 to 30 seconds, 12 to 20 second rest, and then 6 to 8 repetitions for 3 sets. So it's kind of a lot, but you'll get your workout in a really short time. And then I'm going to talk a little bit more about this in a minute, but protein afterwards. So pre-fuel with a carb / protein. And then afterwards, this was really fascinating. I guess I'll just talk about the nutrition part now. There's sort of this metabolic window, anabolic window. What do they call it? Let me see. I don't know. Metabolic window. But basically, women in menopause have a 30-minute window after they work out to sort of supply their protein before like they lose that. And so the recommendation is 30 grams of protein within 30 minutes after stopping exercise. That's kind of nuts. Like I often don't want to eat anything for like an hour. So just something really to think about. And then the annoying, frustrating, not fair part is men have a 4-hour window after they work out, and women have menopausal women specifically have a 30-minute window to resupply that protein. So that's life. It's not fair. I don't know, but use the information to your advantage. So let's just talk about the nutrition piece that they talked about too. Eat enough calories. So especially if you were raised in the 80s and 90s and it was like skinny, calorie deficit, diet everything, blah, blah, blah. What they're now finding, that doesn't work for weight loss in menopause. You need to eat and you need to exercise. That's how you're going to lose weight. So very, very fascinating. And I think I'm in my 40s. I was sort of like in the cusp of that, but people my age and above who are now in menopause, they were raised in that like skinny generation and always eating a calorie deficit. And then also these studies found like intermittent fasting, keto diet, all these things didn't make a meaningful difference in menopause. So you need to eat enough calories, you need to eat enough protein. So the recommendation was like more protein, more vegetables and fruits, and less carbs. Not no carbs, you need carbs, but your carbs should be coming more from vegetables and fruit and then whole grains. So they sort of like gave a generalization like, have you ever seen those pictures of a plate? And so half your plate should be fruits and veggies, a quarter protein and a quarter whole grains as a general recommendation. So really fascinating. So don't diet, eat. Eat. Like women are not eating enough because this diet culture has been instilled in us. And then the other thing that they talked about that was really fascinating too is in menopause, you really got to pay attention to staying hydrated. And so for some people they can do that, but you can't always trust your thirst, especially if you're an active woman and especially if you're like training at elevation or heat or things like that. So in general, they recommended you need an electrolyte drink with exercise. So a 3 to 4% carbohydrate solution. And then this honestly sounds disgusting to me, but this was like a sample recipe is in 1 glass of water, add 1 teaspoon of maple syrup and a dash of salt, and that's your electrolyte balance. It sounds really gross, but I don't know, I haven't tried it, maybe it's okay. But you gotta stay hydrated and water's not enough in menopause. So some really, really, really interesting things. So eat and drink and exercise. Okay, so we talked about cardiovascular. Next thing I want to talk about is strength training. So as a physical therapist, I know this, and strength training is super important. I think kind of the information that I see out there is yes, women in menopause need to be doing strength training. And as physical therapists, we're sort of guilty of under training our clients. Obviously people are coming to us when they have problems, when they're injured, when they have pain, things like that, but we need to get them to a point to know how to train safely, to be able to lift heavy weights and to set them up with a program for success. And so women in menopause really need to lift heavy weights. That's going to build muscle mass. It's going to build bone density. And I'm going to talk a little more about bone density in a minute, which is so, so important at this point in life. But you're not going to get bulky. Like majority of women aren't going to get bulky by lifting heavy weights. So briefly, you need a lot of testosterone to get bulky. That's why men can get bulky, women don't. Women, we have some testosterone, and even that probably dips in menopause. But we don't have a ton of testosterone in our bodies, so we're not gonna get bulky by lifting heavy weights. So we're talking about building muscle, building resilience, building bone strength. And so walking is not enough. Pilates, not enough. Yoga, not enough. You need to lift heavy weights and you need to be training at a high intensity. So heavy weights means like 1 to 4 reps max, okay, for some sets. Not like 10 to 12 reps max. If you're doing 10 to 12 reps, it's not heavy enough. You really got to go for more weight, less reps. So think about that training of like 1 to 4 reps of a heavy enough weight where you're fatigued. So I always tell people like the last 2 reps of anything should be really fatiguing, and that's how you know you're training heavy. Okay, so lift heavier, but get coached. If you're not used to lifting weights, get coached. Work with a physical therapist, work with a personal trainer who can build you up to that point, right? If you haven't been exercising, you can't just go lift heavy weights. You're going to get injured. You're going to end up in a physical therapy office. But work with someone who can train you. Find an online program, find an online trainer. There's tons of information out there. Work with someone in person if you aren't comfortable lifting weights, but lift weights. Okay. Bone health. This to me is the priority. As you age, your bone density gets less, like your bone thickness. So what I was always taught was like, you can build bone up until your 30s and then it either stays the same or it goes down. But according to this lecture, there's a new study that showed even if you have osteoporosis, you can build more bone strength. And that to me is fascinating, exciting, and really, really good piece of information. And I'll tell you, I've worked in the healthcare system, like not just doing pelvic floor therapy, but I've worked in hospitals, nursing homes, home health, all of it. And any healthcare provider will tell you that when an elderly person falls and breaks a hip, that's usually the beginning of the end, unfortunately. But it's such a hard thing to recover from, because generally when you break a hip, they don't just do a hip replacement, they like repair the break, and then usually you can't put weight on it for like X amount of time, and that's incredibly hard. If you're already weak, you're in pain, and now you have one leg you can't put weight on. So I think that is changing. I haven't honestly worked in a hospital or that kind of setting for a few years, like a decade. But I think that might be changing, that they're maybe doing more hip replacements. But it really depends on the state of your bones. If your bones are fragile, they really don't have a lot of options, because even a hip replacement, if this is the middle of your bone marrow, they have to put a pin or they have to attach it to that. They have to attach the replacement to the natural bone. And if this bone doesn't have like a strong outer layer, a strong foundation, there's nothing to pin it to. So it becomes incredibly hard to fix that and very, very painful. So this to me is so important. And if you're a younger woman watching this, like, do these things now. Like, set yourself up for a good aging future. So it's really exciting to know that you can build bone density even if you already have osteopenia, osteoporosis, you're in menopause, you're elderly. Like we've known for some time, you can continue to build muscle, but we didn't know you could continue to build bone density. And so how do you do that? Lift heavy weights. That's why I say walking is not enough, swimming's not enough, cycling, the Peloton, not enough, yoga, not enough, Pilates, not enough. I'm not saying don't do those things. Those are good forms of exercise. If you like them, do them. But you need to do the heavy weightlifting twice a week, 2 or 3 times a week. And the other piece is impact exercise, so jumping. And the recommendation is that for that is 3 times a week, 10-minute sessions, jumping in different directions. Also, they talked about most people when they fall to the side. And so working on that lateral stability and strength and rebound and balance. So as a pelvic floor physical therapist, this is why I'm so passionate about helping people get control of their bladders now. Whatever age you're at, get control of your bladder so that you can jump. And I'm really, really trying to instill this in my younger women and moms, is like, fix your pelvic floor issues, fix your bladder, fix your prolapse, get help so that you can stay active, so you can age well. Because it's much, much harder to catch up when you're 60, 70, 80 versus building strong bones when you're 20, 30, 40. And then when you get past menopause, you'll have a better foundation. You won't be trying to play catch up all the time. So jumping is also important to building bone strength. So often people ask me, like, is walking enough? It's not enough. Hill walking, not enough. It's not enough impact on the bones. So yes, we want weight-bearing exercise. That's better than non-weight bearing. So like the bike, the Peloton, swimming, yoga, non-weight bearing, not good enough. Pilates, Pilates, but we need impact. And so running, jumping, heavy weightlifting, those are your impact things that are going to build muscle and bone strength. And you're going to have better balance, you're going to have better cardiovascular fitness. All these things are important to aging. Like I said, I've seen this in the healthcare system. I've seen the people who are little and frail and eat enough. That's the other thing now. The little tiny ladies, they don't have good bone strength. They don't have good bone density. So eat enough, build bone strength, exercise. And so you can combine these things. You can do your jump training with your strength training, with your cardiovascular training. You can combine those. So a good trainer can set up a program for you that does that, and a lot of gyms have these silver sneaker fitness programs, which probably aren't following these guidelines, but it's probably a good place to start if you don't exercise. Work with a pelvic floor therapist if you're worried about bladder leakage with exercise, with running, jumping, lifting weights. We can help you. That is I love that part of my job, is not just the pelvic floor, but let's fix the pelvic floor and help you exercise better and help you live a healthier life. So for my ladies in menopause, there's hope. It's never too late. And if you haven't done any of these things, start doing one of them, start doing some of them, start walking, start yoga, start Pilates. If those are comfortable places for you to start on the Peloton or the bike at the gym. But then you got to do more. If you want to have healthy bones, healthy muscles, healthy heart, cardiovascular disease is the number one killer for women after menopause. So there's a hormonal component to all of this. Discuss that with your medical doctor. But exercise is important. One more last fascinating fact that I think I already said. If you do the sprint training, there is a positive correlation to having less hot flashes, which is really fascinating. That I don't know why, the high intensity training helped with hot flashes. And then also recovery. So after menopause, you need more sleep, you need more recovery between exercise sessions. So that's why I say find a trainer or a class that combines these things so you can get all of the components in one time and you can have time off to recover. So it's going to take you longer to recover. That's also important for injury prevention, okay? Overtraining, under-eating is a recipe for an injury. So make sure you're getting enough sleep, enough protein, enough calories, enough nutrients, enough hydration. I know, the list is long, but start small. If you need help, reach out and I can help you, or find a physical therapist or a personal trainer who can help you. There's hope. I want you to age well. I want you to be healthy. I don't want you to end up in the hospital with a heart attack, with a hip fracture, with a wrist fracture. There's things you can do. So this was good news. I hope this helped. I will link a blog I wrote also that has sort of a written form of the things I talked about. All right, see you next time.